Before we get back to your phone calls, we wanted to quickly talk to an expert about what we saw in the Cowboys-Giants game yesterday. Obviously, a terrible injury to Dak Prescott. He's carted off the field, a broken ankle, but more than that, I mean, the bone went through the skin. I mean, is going to be a lengthy recovery for Dak Prescott. Dr. Justin Tsai is a foot and ankle surgeon and specialist for Rothman Orthopaedics, and he joins us now. And Dr. Tsai, thank you so much. For the first 24 hours after an injury like the one that Dak Prescott suffered, what would you be looking for as a surgeon to make sure that you know that this was successful and that the player's on their way to recovery?
Yeah, thanks guys for having me on. Sure. So obviously, as you mentioned, it's a compound fracture, which means the bones pop through the skin. Obviously, whenever that happens, you're concerned about infection. So for the first 24 hours, besides making sure that his pain's controlled, you want to make sure there's no sign of infection. There's no fevers, no chills, the skin looks okay. And then generally, once he's stabilized, then the recovery is pretty similar to a typical ankle fracture.
So what's the timeline for him to be able to come back? So, the compound in nature, want to make sure that there's nothing there and that the healing process moves forward. But what about him being able to come back and be the same quarterback after going through this kind of injury, Doc?
Sure. So generally, these patients, if I'm treating them, they take about 6 weeks to be back putting full weight on the leg, and that's usually in some sort of boot or a cast. And then after about 4 to 6 weeks, they start putting weight on it and doing physical therapy at that time. Now, obviously, he's trying to return to an elite level of play, so I would say probably a little bit longer than that, and I would say about 6 weeks or so would be my estimate.
Well, there's a side story here, which is Dak Prescott is still looking for that really big contract. Is there anything that would, if you have this injury once, that it makes you more susceptible to ankle injuries, or will you fully heal, be as good as new after suffering something like this?
They usually go on to heal just fine and return to their prior level of activity. That's assuming, obviously, that the bones heal correctly and there's no infection. But in general, people with this type of injury go on to full recovery and are able to return to their prior level of play.
Final one for me, Doc. The quickness of the surgery, obviously last night we saw the pictures with his brother that were posted on social media. The speed to which you get this surgery done, does that play into it as well?
The reason that they have to get surgery so quick is typically because, that when this bone pops through the skin, you're worried about an infection. And in addition to fixing the bones, you really have to make sure that thing is washed out or clean as soon as possible, because the longer they go with that bone exposed, that leads to a higher risk of infection. So, it's good in the sense that you got the surgery right away and you can start the timeline for recovery right away.
Dr. Justin Tsai is a foot and ankle surgeon at Rothman Orthopaedics. And Dr. Tsai, thank you for your time today. We appreciate your expertise and appreciate you joining us on short notice. Thank you.
Of course. Thank you.
Yeah, and that was
and to learn more about Rothman Orthopaedics, hop online, Rothman NY.